A lot of times there's real animosity between workers and parents, but with him there was always the sense of peace that he was working to help them.
Between 1962 and 63, 15,000 unaccompanied minors were sent over from Cuba, and I happened to be able to come to New Orleans.
I think what makes Carlos' story remarkable is just his own life story, just the fact that he came over from Cuba when he was 15 years old back in 1962.
Most of us had social workers, at least in our situation we did have social workers, especially our social worker who was an attorney in Cuba and then became a social worker here in the States.
I think that's why Carlos has such a passion for the kids that he's working with now.
That inspired me eventually to go into social services.
Carlos has been doing this for so many years. He actually started with the Child Protection Agency in the 70s.
He truly is an angel, and I think he was an angel from the minute he started with that, with DCFS.
He was compassionate.
You knew he was always interested in the children and the families and trying to get them back together.
I was still fairly young at 55 when I retired from the state, 30 years of services, and I knew that there was more that I could offer.
So when he did retire from the agency, it didn't surprise anybody that he went right back into helping kids again.
Children's Health Projects was created back in '87, founded in New York.
After Hurricane Katrina, the Children's Health Fund established the New Orleans Children's Health Project with Tulane University as a direct response to the disaster.
And it really was kind of as a Band-Aid approach. Since then, it's really turned into a primary care source.
And the Children's Health Project is mobile. And not only do we have it as a bus, we also have fixed site clinics, so we are in different locations different days of the week.
The bus is a godsend. The bus here services everyone, no matter document, no document, creed, ethnicity, color, anything. You know, a project like that, and I'm really grateful to Carlos for bringing it here.
Carlos is wonderful. He's our case manager. He is the magic that somehow makes it all happen.
Carlos is making sure that these kids get the medical care that they need.
Patients come in, they automatically trust him. They call or they come in. They don't ask for the doctor, they don't ask for me, they don't ask for Dr. Carlson. They ask for Señor Carlos.
Carlos es muy buena persona, trabaja muy duro.
Can Carlos drive the bus?
I have not seen Carlos drive the bus, but believe me, I believe if Carlos had to drive the bus, certainly Carlos can drive the bus.
I'm involved in the community coaching still, so I hope to continue to coach, and involved with my local church too.
When you meet Carlos, you know that he's a special person. He is just all in.
Well, actually, I'm currently a social worker. So that obviously...
A direct result from your
From his teachings. Yeah. Indirectly and directly. I think that I try to exemplify what he has taught us. So if there's an investment in a client, I give 160%, as my father has.
Earlier in my career, when I first graduated, I tried my hand at selling. I realized I stunk at it, and I was not good at it. I felt bad when I sold something that I don't think people didn't need. So I realized that was not my career goals. I work with a great group of people. It's a small group. It's only 8 of us. And as long as they need me and as long as my health holds up, I hope to stay around for a while.